All right, time now for our Health Watch. And as always, we're joined by Dr. Syed Hussain of Trinity Health New England to talk about two big topics of the day. Sleep maxing, good morning, and fluoridated water. People have been talking about that more, even though it's certainly nothing new. Maybe so much so that people don't even understand what water fluoridation is or what purpose it tries to serve. So let's start with that.
Yeah, let's talk about it. So water fluoridation, actually, it's fluoride in water, which is a mineral.
Yep.
And our water has been supplemented with fluoride since the late 1940s, Tim, in the U.S. So now 3/4 of the U.S. population, that's a little over 200 million people, drink water that has fluoride in it. Why do we do that? Because it prevents cavities. So the basic premise of fluoride, a mechanism of action, is that it strengthens the enamel, which is the outer covering of your tooth. That corrodes over time because of acids and sugary substances in the mouth. So in children, studies have looked at this. In children, it really does play a beneficial role. Now, why is it a little bit more controversial now? Is because there have been studies out there that have come out that say maybe the benefits may not be that much, because remember, now we have fluoride in toothpaste and mouthwash and so many other different products.
Areas, right, that they weren't in 1940s.
That's
so
right.
I guess the question is, do we even need fluoridated? Well, what are the risks, and are they significant?
So the studies have indicated that in pregnant women who have been taking higher levels of fluoride in their water, it may be related to neurobehavioral issues later on in children, in babies. Okay. Yes. And or even another study that indicated that it may be a lower IQ in children related to high fluoride levels. So suffice to say, I don't want viewers to panic. This has led to discussions, conversations, debate within the medical community, which is a good sign. Yeah. In fact, there was a federal judge a couple months ago who requested the EPA, the Environmental Protection Agency, to take a look at fluoride levels and what's safe, which is, again, guarded by EPA along with the U.S. Department of Health and Human Services.
I like the point you just made. This internal debate, that is a good thing. Science somewhere, in some ways, at its very nature, is adversarial, right? People try to put up theories, they try to get disproven. That's how we get to the truth.
Got to look at the data.
Absolutely. All right, on to sleep maxing now, where people obviously and understandably are trying to get the most out of their night's sleep, but it's leading them to do some things that may or may not be helping, like mouth tape, or we've heard of sleepy girl mocktail, all sorts of stuff.
Yes.
What do we need to know about that?
So another viral fad on TikTok, Tim, I'm glad we're discussing it, because most of these things, like you alluded to right now, such as putting duct tape over your mouth, nostrils, expanding nostrils while sleeping, these are not scientific methods of better sleep.
Yeah.
Sleep is back in the limelight, so to speak, because of the pandemic. It served as a catalyst where people started looking at, wellness and, work-life balance and all that, which is great. The CDC recommends for an average adult that they should get 7 hours of sleep, but using some of these fads will be dangerous. There's another fad. You mentioned the mocktail, which actually includes magnesium. So if you're, thinking of trying something like that, please have a discussion with your doctor first, because magnesium may play a role in terms of your underlying medical problems, or if you're on certain medications that may have an interaction with magnesium.
Real quick, some bullet points for a healthy night's sleep.
Okay, it's the basics, Tim. So put down those screens, put down those phones, those iPads, those laptops an hour before sleep at the very least. Working out is great. Don't put in a high-intensity workout a few hours before sleep. Avoid caffeine 6 hours before sleep. If you drink, then avoid alcoholic drink, 3 hours before bedtime. And have a dark, cool room. Yeah. All of those things are basics, but sometimes we don't always stick to them, especially the screen time.
Yeah, yes, absolutely. That's just not going to happen for a lot of people, but it should. Doctor, thank you so much.
Thank you.
Dr. Syed Hussain got to a lot, as he always does.